Welcome everyone to our weekly chat with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us today.
Hi again.
Hi, so my name is Dilshad Burman. I am a writer and reporter with City and 680 News, and I will be moderating this chat today. The way it works is we've been collecting all of your questions over the past week, and we're going to present them to the doctor today, and she's going to answer as many questions as we can in 30 minutes. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we'll try to get to as many questions as we can. For now, let's get started right away. Doctor, are you ready?
Yeah, let's go.
Okay, so this week, as is expected, we've had a lot of vaccine questions. So we're going to start with this question, which actually the province's Associate Medical Officer of Health also addressed yesterday regarding what exactly the vaccine does. So Mike asks, is someone still contagious and able to spread the virus if they have received one of the vaccines?
So the answer to that is probably no, but we don't have the definitive science based on that. We know that if you get the vaccine, it will prevent you from getting sick.
Yes.
But that question on transmission, actually, will you then still be able to get a mild infection, say, or pass it to others? Or that part is not known, but we do know that you'll be able to be prevented from getting sick.
Okay, so essentially it prevents you from illness, but whether or not you are infectious still and can pass it on to others is not known yet.
That's right. It's likely that you won't be able to, because if you block the infection from yourself, you probably won't be able to spread it. But again, we're going to wait for the science till we have the answer to be able to provide the answer.
Right, absolutely. And then D asks, how long does it take for the body to become immune once you get the vaccine?
Okay, so we know that it takes 2 doses, first of all. The doses are about 21 days apart. And at least 7 days after your second dose, so, within a month, you will then have protection. Even after the first dose, you will have some protection a few weeks later, but really for that full protection, you need the 2 doses 21 days apart, and then to wait at least 1 week or 2 weeks after for that full protection.
Okay. Chris asks, how will we test for immunity after somebody's been vaccinated? Will we then get an antigen test to see if we still have protection from the vaccine a year or 2 years or 3 years from the date of vaccination?
We're not going to do that on a broad population-based level. The studies, though, will continue to be ongoing to look at, we call that a correlate of protection, the antibodies. We sometimes know, though, that the antibodies might not necessarily, if you have them or you don't have them, might not necessarily mean that your immune system is protected or not protected. I think the real test is going to be looking at those people who get the vaccine, how many of them get disease, how many of them get sick with COVID compared to those who don't get the vaccine, and look into that year over year into the future. Will be able to help tell us how long the vaccine protection will last.
Okay. Amy asks, how will the government inform people that they have been selected to get the vaccine, or will everybody need to sign up online, something like that?
Yeah, so we'll get more details. What we're going to find is that it's the prioritized populations, and that just means that those who are at higher risk for whatever reason will be eligible first. And so right now, it's those who live or work in a long-term care home setting. And then, healthcare workers will be next. And so as we get more and more to the general public based on age, for example, there will be more guidance on, first of all, where you can get the vaccine. Do you need to show proof before you get vaccinated? Can you get it from your doctor's office? All of these kinds of questions.
Okay, so that rollout plan is still developing, basically.
Yeah, I mean, a lot of it is dependent upon which vaccine will we have, when will we have the vaccine, how much vaccine will we have exactly. But those plans are being undertaken right now for sure.
Right. And so you mentioned age might be a factor in, who gets the vaccine first. So Jay actually has a connected question. He says, how will we know who in the community is of a certain age? He says, my father is 101 and he lives on his own, and he has had to use walk-in clinics since his family doctor retired. How will anybody know that he is in that priority group, and how will he be contacted to know that he has to get vaccinated?
Yeah, well, congratulations on having a father who's 101. That's really fantastic. I think what you can expect is there might be public announcement, for example, to say, okay, now those who are of this age are eligible for the vaccine. You can come to the clinic. As part of our Toronto Public Health consent form, we ask your date of birth, what your age is. And so that might be a check, for example, to make sure that you are eligible to receive it. We certainly do usually have eligibility criteria to make sure that we're giving the vaccine to those who it is available for. And so I think you can rely a lot on the public messaging if you don't have other means for your dad to know when he's eligible for the vaccine.
Right. And then DW asks, I am a type 1 diabetic that turned 50 this year. My specialist does not see me until February. My question is, who will advise what vaccine should be taken when it rolls out to somebody like me?
Yeah, so first things to say is those who have chronic health conditions like diabetes can still safely get the vaccine as long as you don't, you've never had a severe reaction to this vaccine or you don't have a severe reaction to some of the ingredients in the vaccine. And so again, we'll have to wait and see what's the prioritization. Will it be because you're 50 that you'll get it? Will it be because you have a chronic health condition, or maybe both? And so it will depend on which vaccine is available too at the time when your turn is called, so to speak, and which one will be available and which one you can get. But this current vaccine, you would be able to get it even with the diabetes.
Okay. So actually, you just said this, but I'll just reiterate. Wings asks, will we know which vaccine will be injected into us? And is there a choice between, I guess, Pfizer and Moderna at this point?
There's no question you will know which vaccine you're getting. That's part of the informed consent process. And so, what does informed consent look like? Well, we have a fact sheet that, you read beforehand. It has a lot of information. And then you fill out a consent form that asks you questions to make sure that, you're indicated to get the vaccine, that you don't have contraindications. And then you have an opportunity to ask questions about the vaccine, to have them answered. And part of that is knowing which vaccine you would receive. Mm-hmm. And so again, a lot of that is going to depend on which vaccines we have available in Toronto, in Ontario at that time.
Okay. And so, Doctor, you mentioned with the Pfizer vaccine, you have to get 2 doses. With the other one that we are getting, I believe it's Moderna, is that also a 2-dose vaccine?
It looks like a 2-dose schedule as well, yes. So, but again, there's many more vaccines down the pipeline as well. Usually vaccines, especially newer vaccines, do have more than 1 dose. That second dose acts as a booster dose. And so the first dose, you develop immunity to it. And then to make sure you kind of get more longer term immunity, usually that second dose, the booster dose, helps so that your body can produce more antibodies, more immunity. And that's the reason usually why there is more than 1 dose.
Right. Okay. This is, I guess, a technical question. Then Americo asks, how do you inject a vaccine that is held at -70 into a person's arm?
Right. Yeah. So there are a lot of really good logistics that have to be worked through. So this vaccine actually first has to it has to be thawed actually before you can provide it. So we have actually guidelines on how to do this. You can thaw it in the refrigerator for a certain number of days, even at room temperature for a certain time period. And then what you actually do is it's actually just a substance in there. You actually inject some sterile normal saline into it, and then you gently shake it. You don't shake it, actually. You actually gently turn it. We don't want to shake it because that can disrupt the vaccine. And then it just draws up just like a regular vaccine, actually. It's just actually liquid, and it goes in your arm the same way that you would have got your flu shot.
Okay. So it doesn't have to be cold the entire time, essentially.
Yeah.
That's the question. It's like, if it's -70 and it's going into my arm, will it freeze? So
that's right. Yeah.
Okay. So, Jennifer asks, when will the vaccination centers outside of Toronto and Ottawa be announced? I have heard that there will be 14 across Ontario.
Yeah, so we'll have to wait for the announcement. Again, provincially, there's a lot of work going on, and you can expect that it's going to be available throughout the province. It's not that only certain areas are going to get it.
Okay. LP asks, if one should get the vaccine, where do they go to get it done?
So again, we'll have to wait for those. Right now, this vaccine in Toronto is being provided to certain staff at UHN.
Yes.
That's the way this is being rolled out, but they're not all of the vaccine is going to be just administered through one hospital.
Right.
So again, more to come on that.
Yeah. And then Anthony asks, I'm immunocompromised. Am I eligible for the COVID-19 vaccine?
So if you're immune compromised, either because you have an illness or because you're on medication, right now the Pfizer vaccine didn't actually include you in their trials. And so we don't actually know based on the data whether the vaccine is going to work or whether it's safe, because they actually didn't have people who were immune compromised in the trial. Mm-hmm. And so right now, the recommendation really is that you shouldn't, in general, get the vaccine. However, if you're immune compromised and you have a conversation with your doctor to balance the benefits and risks, of COVID versus this new vaccine, you can consider getting the vaccine in that circumstance.
Right. Okay. And this is, again, like you've been mentioning over and over, it's about informed consent. It's about talking to your doctor, figuring out personally what would work for you, right?
That's right. And everyone's benefits and risk ratio is different based on what their own illness is, based on their COVID activity in the community, all of those kinds of things.
Right. Okay, Bren Bell asks, my daughter has a severe anaphylactic allergy and carries an EpiPen. I understand that people with this affliction have proved to have an adverse reaction, and therefore those with anaphylaxis were advised not to get the vaccine. She's very worried as to how her daughter can be safe against COVID-19 moving forward. And also, will she not be able to move through the community without proof that she's been vaccinated? Because we have heard that people who can't get vaccinated or refuse to get vaccinated may face certain restrictions for certain activities.
Yeah, so the good news on the anaphylaxis piece is that there are new guidelines that are coming out to really define that. And what we found was the people in England who got anaphylaxis had an allergy to one of the ingredients. It's PEG. I can't even pronounce that long name. It's actually in laxatives. It's in some medications, Tylenol liquid, for example. So if you have that allergy, well, then you should not be getting this vaccine. But if you have, say, an allergy to a food or to another medication, you can actually still get this vaccine. That's what the guidance that's coming out is saying, is that it's not everyone who's had an anaphylactic reaction that cannot get the vaccine. Now, if you have severe allergies, it may be that you stay at your doctor's office when you get it for a bit longer to watch for symptoms, but that's not considered a contraindication. And again, as we get more and more information, we'll be able to define that a bit better. So that's the good news.
Okay. And then, I know that the legislation around this probably hasn't been, even discussed yet or in play yet, but when it comes to people who cannot or refuse to get the vaccine, based on medical reasons, then would they be exempt from all of these kind of restrictions that will probably be put in place for those who don't get the vaccine?
Yeah, so you see, same with the mask legislation that we have, there is a medical exemption. And so you can expect that if there is legislation where in certain places, for example, you're required to have the vaccine, that there's often a medical exemption because those for very legitimate medical reasons that can't get the vaccine, there is an accommodation for that in general. And so I can say in schools where vaccines, you need either proof of vaccination or an exemption, there is a medical exemption available in those circumstances.
Okay, perfect. Lucia asks, if you have antibodies, do you still need to get the vaccine shot?
So this is the question, is if you've had COVID before, do you get vaccinated? Can you get vaccinated? The Pfizer study actually excluded people who had known antibodies to COVID. It doesn't now, but what we don't know is that if you actually had COVID, how long will your immunity last? We know that there is reinfection. And so the recommendation is that even if you've had COVID, you can get vaccinated, and that is the recommendation. Okay.
Melanie asks, after a bone marrow transplant 18 years ago, I had a severe reaction to cyclosporine. Is it safe for me to get the vaccine?
Right. So cyclosporin is not one of the ingredients that's in the vaccine. And so that's not a contraindication to getting vaccinated. Now, if you had a bone marrow transplant, if you're on immunosuppressive drugs, that may be something that you would have to have a conversation for. But cyclosporin in general is not a contraindication to this vaccine.
Okay, perfect. And then let's see. So Marie asks, if you test positive for COVID-19, did they do trials on people who had the virus and then took the vaccine on top of being positive?
So right now, the study, the results that have come out on those 44,000 people excluded people who were positive, but previously positive or had antibodies. So, but we're expecting more information on that piece coming forward. And, the real world experience is going to be important as well, too. Like we know, for example, in Canada, based on the studies, the number of people that we know have tested positive for COVID is still a smaller proportion compared to those when you do blood samples through the Canadian Blood Services, for example, who actually have antibodies. And so you can expect, through the UK, through the USA, they're providing the vaccine as well, that there will be many people who previously had COVID and are going to get the vaccine. And so hopefully we'll be able to answer those specific questions better in the coming days.
Right, absolutely. Because we're not just insulated in Canada. There's so many worldwide. I mean, people are taking the vaccine now worldwide. So
yeah, and it is the same vaccine. So that's the other important point to note. Yeah.
Yes, and I think one of the things that you've mentioned previously several times is that if you are currently undergoing, symptoms, or you currently have COVID, then it's not recommended that you take a vaccine while you're still sick.
That's right. So just like with the flu vaccine, like we say, first of all, if you're sick and you have COVID, you shouldn't leave the house unless it's really important for medical reasons. And so we want you to recover before you get vaccinated. Some of that is also because we don't know, like if you have a reaction, is that the COVID, is that the vaccine? Yeah. Plus, we want your immune system to be at its best when you get vaccinated as well.
Right, absolutely. And then Kat asks, is it safe to get the vaccine if you have COVID essentially, but you're asymptomatic and you don't actually know that you have it?
Yeah, so in the study, I'm sure there were people who were asymptomatic. They didn't necessarily always keep testing to see if they were asymptomatic ongoing through the study. Mm-hmm. So again, right now it's considered safe, and you can go ahead and get the vaccine, even if, say, you had COVID and you never knew about it. And hopefully we'll have some more data in the future to be able to help us answer that question with more data.
Okay. And then this is a Twitter question. @42thetruth asks, how would you know if you are allergic to the vaccine? Are the ingredients similar to most every other vaccine, like flu? She says, or he says, I don't always get the flu vaccine, but haven't experienced allergic reactions. So would that be a good indicator that I'm not allergic to the Pfizer vaccine?
Yeah, so the ingredients in the Pfizer vaccine, actually, there aren't many ingredients. Sucrose, water, potassium chloride, like some of those things you actually probably can't even be allergic to. The big ingredient that people think are causing the allergic reactions is that PEG, which again is, if you've had a laxative, it's in some foods, it's in some additives. And so because it's in so many other things, that if you haven't had a reaction to those, in general, then you're probably okay. It's not something that you need to have an allergy test for to see if you have an allergy against this. It is a quite commonly used ingredient.
Okay. And then Kim asks, I currently have frozen shoulder in my left arm. Can I get the vaccine in the other arm? I really don't want pain in both my arms, and I hear there can be soreness after you get the vaccine.
Yeah, so it doesn't matter which arm you get. It's the deltoid muscle that we're trying to inject in. Usually we pick the non-dominant hand, so you can still, use your dominant hand if you need to. But yeah, that would be fine. I think you're right, though, that the vaccine you can expect when you get it, that you'll get redness, soreness, swelling where you got the injection. That's to be expected. And then you can also kind of feel unwell, have a headache. and that can last for a couple of days but resolves. And that's usually a sign that your immune system is actually working, that it's responding to the vaccine and developing immunity.
Right. So actually, we did hear about these mild sort of side effects, so to speak. And so that's just very normal, is to feel a little bit unwell, feel a little bit run down soon after you get the vaccine.
Yeah, and you could get a fever as well. Exactly. Those are all symptoms of your immune system working. And in this case, it's working to develop antibodies in response to the vaccine.
Okay, perfect. And I guess this one is just similar. We just talked about it, but Anonymous asks, I have a sensitivity to eggs. Which vaccine should I get?
So right now, eggs is not a contraindication for the Pfizer vaccine. So, and so that now, if you're especially concerned about it, I would talk to your doctor about it. Something that you can consider is after you get vaccinated to wait for a little bit longer to make sure that you don't have a reaction. But egg is not a contraindication for this vaccine.
Okay, perfect. Okay, let's move on to some non-vaccine questions in just the last 10 minutes of the chat that we have left. Let's see. San asks, how long is there viral shedding for someone with a cough? My husband was diagnosed with COVID-19 the day before our baby was born. We have isolated apart for 16 days. He is cleared by public health, but I'm still worried about bringing the newborn home with him still coughing.
So, okay, so you can actually get a cough from COVID that can last for weeks and weeks and weeks and weeks. And that's considered a post-viral cough. That's what we call it. It's just kind of the irritation in your lungs because of the infection that you've had, but it doesn't necessarily mean that you're infectious. And so if your husband did his 10 days of self-isolation, and his symptoms mostly improved, he just has this cough, like as long as it's a mild cough, then you wouldn't have to worry. He would be considered not contagious. Now, if his cough is severe or he still has a fever, his symptoms are not getting better, then that's a different story. And to say that sometimes that cough, that nagging cough that can persist, you can actually try some treatments for it as well, like puffers, for example. Sometimes that can help to treat the cough as well. So he could talk to his doctor about that.
Right. Okay. But in general, we've said that like after 10 days, maximum 14 days, you're good to go. If your symptoms have subsided, you're no longer contagious.
Yeah, 10 days. And then it's actually 20 days or more if you were hospitalized or you had a weakened immune system. Yeah.
Okay. And so this is a kind of related question then. Diane asks, why are individuals who have tested positive for COVID in the community not required to take a follow-up COVID test to ensure that there's a negative result before returning to work or school or whatever? And she asks, what scientific evidence supports our current procedure of completing a 10-day isolation and then, freely returning to your daily routine? She says, my concern is they still might be positive for COVID after the 10 days, as we've seen cases where patients are testing positive for weeks and months after their initial positive test.
Yeah, so you know what, we're learning more about this. And, in the beginning, in January, February, March even, when you were positive, we would wait for you to turn negative before releasing you. But we found actually people could be positive for weeks, for months, even later, but they weren't actually contagious. And so this is based on studies that have actually, taken those samples, 10 days, 20 days, 30 days, and growed them. And there's no virus that actually grows. You're just shedding what's considered to be a dead virus, so to speak. And so the studies have shown that you're actually contagious for the 10 days. As long as your symptoms are improving, that's a sign that you're now no longer contagious, that if you may still be positive, you may still be shedding virus, but it's not virus that can infect another person. And so that's how our guidance has changed, and that's what the studies are based on, and that's why we use what's called a time-based approach, 10 days for most people, rather than testing. And we don't actually recommend that you be tested because we know that you can be positive, but it doesn't mean that you're contagious, and it doesn't mean that you had a more severe infection or a less severe infection. It just means that you're still continuing to have this shedding that's not necessarily indicative of being able to transmit to others.
Right. Okay. So Bruce asks, when will the government be specific and tell people not to socialize outside their immediate household at Christmas? Plenty of people apparently are still planning to do so.
I'll say it now. don't socialize outside of your household. I mean, we have to this holiday stick with our household only, the people that we live with, and for everyone else, do it virtually. The only exception is if someone lives alone, they can connect with one other household. But yes, that has been our message. If people haven't heard it, please provide the message to them. Dr. Davila has provided it. We've heard it provincially. This is something that we have to do because we know that COVID likes holidays, COVID likes gatherings, COVID will spread, and we really need to prevent that.
Right, absolutely. Okay, so DW has a question. He says, as an electrical contractor, I've had a hard time getting definitive answers about COVID policies for the construction sector. Home building is continuing throughout the province as if everything is normal. And sub-trades have to deal with working with multiple trades within the same house or building, like, you know, plumbing and electricians and things like that all together. And they don't all wear masks. Some do, some don't. He says that the health and safety person, you know, can't enforce the masking. So are there actually policies for the construction sector when it comes down to these nitty-gritty things?
Yeah, so we actually on our website have recommendations for workplaces in general. It doesn't specify, it's actually for all workplaces. And in all indoor public settings, everyone's required to wear a mask. There are, from a workplace health and safety perspective, like the Ministry of Labor has requirements to keep workers safe as well, which would include masks. So I think that this is something that you could bring to, you know, whoever's in charge of the work site or the workplace. We certainly have seen COVID spread in workplaces. And so making sure that when you're working that you are protected. Now, if you're able to keep that physical distance, when you can't, wearing a mask is extremely crucial in those settings as well as many other interventions as well. So I would follow up with your boss if you have one, or consult our Toronto Public Health Guidelines to see what we are recommending.
Okay. And then Ted asks, my son is coming back from BC. Does he need to quarantine?
So what we're recommending is for people who are coming back, students, say, who are returning for the holidays, if they can, where they are going to school, they should try and quarantine there. So, you know, as much as they can for 14 days before they travel home, to limit contact with others, to not socialize, to sort of self-isolate before they travel home. That will reduce their chances of bringing COVID with them home. If they're unable to do that, then, you know, you can consider a sort of a modified self-isolation in the home, you know, where they have a separate room, maybe separate bathroom, so that, again, if they are potentially contagious or incubating, they won't spread it to the rest of the household.
Right. Okay, we don't have much time, but I'm going to try and squeeze this one in. Brenda asks, will asymptomatic testing be extended in more Toronto schools? Because currently there's a pilot project going on, I believe. And she says it seems that whenever this happens, we immediately discover new cases.
Yeah, so I mean, I think the one thing to note is that we expect to find asymptomatic cases in schools. That's the nature of COVID, is that we know, especially in children, that some of them can have asymptomatic infection. We also know that you can be asymptomatic 2 days before you have symptoms and can still attend school because you passed the screening. And so those layers of public health measures are in place in schools to prevent the spread. Now, we do recommend that broader testing if there's a school where we find there's someone in the school who we can't figure out where they got the infection from, and that may mean that there's asymptomatic cases that we're unaware of that we need to find out about, or if there have been multiple cohorts who have been dismissed, to get more information on that. So that's our current approach. Now, in the new year, there may be more options available for broader testing in schools. And so I would just say more to come on that.
Okay. So more schools might be included in the project then.
We'll have to wait to see what the Ministry of Education comes up with in terms of their guidelines or recommendations for schools. Yeah.
Okay. And I think we're almost out of time. So let's just quickly say, Jim asks, and again, we've talked about this, what are the long-term impacts of coronavirus, of the COVID-19 virus?
So again, we're learning more about the long-term impacts. Like we've only had less than a year, say, with the virus. We do know that with coronavirus, as well as with other viruses, that some people can get these long-lasting symptoms like fatigue or cough we talked about today, for example. And so we're going to have to give it some more time to see really what are the long-term impacts. I think what's fair to say is that you can't necessarily predict who is going to have a more difficult recovery and have some of these more long-term impacts.
Okay, and that brings us to 1 o'clock. We actually have a live question coming in, Reina, but we will get to you next week. We're out of time for this week. Thank you so much, Doctor, for joining us. And please keep your questions coming. We'll try and get to as many as we can next week. And thank you, everybody, for joining us today. Thanks, Doctor.
Okay, thanks. Bye.
Bye-bye.